Hello everyone, my name is Melissa Williams and I'm going to talk to you today about test taking strategies, not just the trick strategies. That's honestly at the very end of the presentation. This presentation is a culmination of my almost 8 years in higher ed talking about how to get better at test taking. So it's going to be a lot of information, but you have access to this video. You can pause it when you need to stop listening to my voice, get away from it for a while. I hope you enjoy it. Thanks. Let's get started. So where do we start? I really like to start with talking about why students get test questions wrong in the first place. So we're going to start there. Then we're going to talk about something you probably haven't heard before, and that's metacognitive wrapping. It's something you might be already doing, but it's just an evidence-based term that we're going to talk about that is super important. Then we're going to hit test-taking strategies and practice using them. Each one of these topics is equally important, so I really encourage you to watch all the way through. Let's talk about why students get questions wrong on an exam. I am sure you can look at this list and think, yep, I got a question wrong because of that before. If you can get rid of some of these as you're testing, if we can figure out ways to get rid of these issues while you're testing, your exam scores are going to skyrocket for the better. It's going to be so great. So here are some of the common things when I'm doing exam reviews with students that I see often. Misreading a question. They just misread it. They misunderstood what it was asking. Sometimes they're answering a question that's not actually being asked because they don't really know what the question is truly asking. A lot of times students will change their answers. So they will answer the question with their gut reaction, and then they're saying, well, let me go back and reread it and re-answer it. And then they talk themselves out of it. I'm sure you've been there a time or two. A lot of times you can get questions wrong because you rush and then you skim. And this tends to happen very often if you are really nervous for a test, or if you're struggling with some test anxiety that's causing you to have more of a fight or flight response, because that fight or flight response of stress can cause you to not pay attention to the details because you feel like there's an emotional threat and it's trying to get you out of that situation. So generally speaking, when you skim and when you rush, that's when you make those mistakes where you miss a word, miss a key word. That's really important and integral to your answer. And then finally, lack of content knowledge or just not studying the way you should. So there's a difference between going into a test and feeling ready for it and then going into a test not feeling ready for it. If you don't feel ready for your test, that last bullet point there is the one for you. But if you've ever gone into a test before and felt good, and as you're taking the test, you feel good, and then you get your score and you're like, what is that? Then some of these things are probably happening, and hopefully this presentation will help walk you through correcting some of that. So we're going to start with the thinking process because that's going to give us a lot of insight. And the thinking process really has to do with metacognition. So metacognitive wrapping is just a fancy evidence-based term for thinking about the way that you think and asking yourself questions as you go along throughout your test. So metacognition literally means thinking about the way you think. Once you think about the way you think, you're going to really hone in on what you know and what you don't know. And it's going to give you a lot more awareness and a lot more ability to improve your critical thinking along the way. The wrapping part of things means you're just going to ask yourself questions. For example, if you're reading an exam question, instead of just reading the question and reading the answer options right away, if you instead read the question and as you're doing that, identifying the keywords, saying, okay, what's the important words in this question? And then asking yourself, okay, what is the question really asking me? And then if I had to rephrase the question in my own words, how would I rephrase it? Or if this was a fill in the blank, what would I write? Or what is the pathophysiology of the disease process? See how I can keep asking myself questions. The more that you can be really cognizant of what you're talking to yourself about during a test instead of just reading the question and reading the answer options and letting the answer options kind of dictate how you're thinking. Instead, using metacognitive wrapping as an evidence-based way to improve your test taking by being very forthright with how you're going to approach your test questions and how you're going to approach your answer options. I got rid of my video so that I didn't block half the screen, but I wanted to take a quick second and talk about the process that I use to approach exam questions. I read it, I recognize the keywords, and then I wrap it. Some of you may already be doing this and not realizing that you have a process yourself. Many students, from my experience over the almost 8 years working in higher ed, doing exam reviews, most students will read the question, read the answer options, and try to answer it. That's generally their process. That's generally how you've made it through school up until now. However, NCLEX style questions require a little bit more. They require you to dig, and that's where the wrapping part comes into play. When I say read the question, I mean read every single word of the question. A lot of times, when you're in a testing environment, that fight or flight kicks in, just like we talked about, and it makes you skim and you miss things and you go back and you're like, oh my gosh, I can't believe that I missed that. When it's not really that you had a content issue, it's just, it was, you know, a fight or flight thing going on. So read every single word of the question. And as you're doing that, be cognizant of the key words and the strategic words that are in the question itself. Then I want you to wrap the question in answer options. So it kind of rhymes. It's an alliteration: read, recognize, and wrap. To wrap the question, I want you to ask yourself, what are the words in this question that I should be paying attention to? Literally, as you're reading, I want you to think about what's going on in the scenario. The really big important question that must be asked of yourself is, what is this specifically asking me to answer? What is this question asking me? Not rephrasing it in the same words the question is talking about, but in your own words. What is it literally asking me? And we're going to actually talk about that a little bit more in the future. And then before you look at the answer options, ask yourself, what do I know about this content? If this was a fill in the blank, what would I write? Just like I wanted you to wrap the question with paying attention to the keywords in the question, like identifying those, I want you to do the same thing while you're evaluating your answer options. I also want you to think about, what does each answer option mean? What could it mean related to my question? And if you don't like an answer option, why don't you like that answer option? Especially while you're practicing, I want you to literally take time to say, I don't like this answer option because, or I do like this answer option because. Giving a rationalization to something really helps you get and cut through the weeds of incorrect and correct responses. And if you find that you can't say why you do or you don't like something, that is a really outstanding clue that you need to go back and redo some of that content and spend a little bit more time there. So of all the years that I've done exam reviews with students, the best question I could ever ask for you to improve your exam grades is, what is that question specifically asking? In your own words, not rereading the question, but what is the question literally getting at? What is it asking you? If you can figure that out, that's half the battle. So here's my challenge to you. I want you to do a little test for yourself. I want you to go find any NCLEX questions you can get your hands on. So go on the internet, go in your textbooks, wherever you can find NCLEX questions. And I don't want you to look at answer options. All I want you to do is read the question, identify the keywords, and then rephrase that question into your own words without saying the exact same wording of the test question. I want you to pretend like you're talking to a 3-year-old and teaching that 3-year-old what that question is about. Get to the core of it. Rephrase it as concisely as possible. And we're going to practice that here coming up in a second. So let's practice this, all right? So A client with a 5-year history of ulcerative colitis is admitted to the hospital with an exacerbation of the disease. Which of the following factors was most likely of greatest significance in causing the exacerbation that led to admission? I'm going to stay silent for a minute. I'm going to give you time to reread that if you want to, and think about what is this question truly asking. Rephrase it into your own words. All right, so let's see some of my ways. Here's what I got at. What probably caused this client with ulcerative colitis to get worse? What probably caused them to get worse? So instead of using the fancy wording, the core of that is what could cause somebody to get worse. Or you could also say, just really clearly like that, what can make ulcerative colitis worse? Because that's the root of this question. If you know that information, when you go to look at those answer options, it will be a lot easier to say, okay, this is what can cause somebody to get worse, and now I'm seeing it down here, therefore that answer is probably correct. Let's try another one. The nurse devises a teaching plan for a client diagnosed with aplastic anemia. Which of the following is the most important concept to teach for health promotion and maintenance? Here's what you could say. What's the safety thing to teach about for aplastic anemia, right? Or what's the biggest safety thing to teach clients with aplastic anemia to stay or get healthy? I don't know if you noticed this when I read the question, I said which of the following is the most important concept. I really accentuated that phrasing, the most, because that's really important. That means you're going to make a judgment call. We're going to talk about that later. But which of the following is the most important concept to teach for health promotion and maintenance is a mouthful. So if we're talking about aplastic anemia and health promotion and maintenance means to, stay or get healthy, how can I keep my client with aplastic anemia healthy? How can I do that? How can I prevent harm for them? And here's a last and final question that we're going to practice this on. The nurse notes that the primary healthcare provider has prescribed sulfasalazine for a client. The nurse checks the nursing history form in the client's medical record for the documentation of an allergy to which of the following? So go ahead, reread that, and rephrase that in your own words. You could simply say, what's related to sulfasalazine? Or you could say, if a client is allergic to another medication, you would have to think through that, then they shouldn't take sulfasalazine. Or you could say, if the client is allergic to sulfasalazine, what else could they be allergic to? That one to me sounds like the way I probably would do it right off the bat, because it's telling me that it's a sulfa drug. So to me, the first thing that comes to my mind is this part right here that says sulfa. So this is a sulfa drug. So my answer probably is going to revolve around the fact that if I'm allergic to sulfa drugs, I probably should not be taking this medication. You guys ready for it? Now we're going to get into the good stuff, right? Like all that stuff leading up to it, Mel's just kind of talking and talking. So this is really where the meat and potatoes of this presentation is going to last. If you need a break, just go ahead and pause it here. You can come back to this spot. Just look for the life raft little thing there. So it's important that you know how to read a question. If you do not feel comfortable with that yet, just don't watch any further. Go practice that. Go practice taking questions and putting them into your own words. I promise you that's a skill that's going to help you. I've had so many senior level students come into my office year after year after year, students who have struggled throughout their entire nursing school career, who when I ask them to rephrase a question into their own words, they cannot do it. They just reread the question. And once they get the hang of that, their whole game has changed from then on. It's like a light bulb goes off. Oh my goodness, I haven't really been paying attention to what the question is truly asking. I promise you, you're not going to waste your time if you spend a little bit of time trying to hone that skill in. Let's start with a little housekeeping. Content knowledge is your biggest strategy. It is paramount. You should never approach test questions trying to trick them to your correct answer. No, you're going to end up with really bad exam scores, and you're not going to be a really confident nurse later on because you don't have the content knowledge. So as you're going through your classes and you're studying for your exams, don't just study to pass a test. Yes, obviously you have to pass the test, but you need to know your content knowledge so that that's your first line defense on getting a good grade and being a good nurse. I want you to use metacognitive wrapping for your questions and your answers. Some of these strategies will be last resort options instead of doing eeny, meeny, miny, mo, and I'll let you know which ones those are. I want you to practice, so get your hands on practice questions and use these strategies, because I've had students who come back to me after doing test taking strategies who say that they just don't like using them because it makes them feel more stressed out during an exam. Well, if you don't practice these in a safe, non-testing environment and get used to using them and implementing them in ways that work for you, it's going to become a source of stress for you during a test. So if that's the case, then just don't even watch the rest of this video. Then you need to also give yourself grace. You're going to get things wrong. Be okay with getting things wrong if you have a learning mindset to say, okay, I may have got this wrong, however, I learned something new from either the content in the question or learning how to eliminate answer options or using my testing strategies, whatever the case may be. If you have that growth and learning mindset, that's going to be a lot more productive than being so mean to yourself, because it just makes it for a really stressful time. All right, I'm starting with everybody's favorite type of question, right? Select alls. Oh, I know better than that. I know better. This is the dreaded question. The dreaded question, right? The select all. So I'll start there. There's a lot of things that you can do. One thing that you should, stay away from is don't look at your answer options and group them. It's not which answer options go together. It's does this question go with this answer option, yes or no? Once you think about that, then you move on. So I really like to take the answer options and think of them as true-false questions. So I'll read the question, I'll identify the keywords, and then I'll think about it. And then after I've identified those keywords, I'll insert them into the answer options to make a new sentence that's a true-false question, and then I think about it. It sounds complicated, but it's not. So let's take a look. What should the nurse teach the client to do to prevent stress incontinence? Select all and apply. So what are the keywords in there? I'm going to give you a second and then I'm going to underline. So if I said underline the keywords, or what are the keywords, what would you say? Hopefully you're saying you need to teach preventing stress incontinence. That's the core of this question. I need to prevent stress incontinence and I got to teach it to my client. So I take those keywords and I use them in my first answer option. There's a couple different ways you could say it. You could say, to prevent stress incontinence, you can teach your client to use techniques that strengthen the sphincter and structural supports of the bladder, such as Kegel exercises. And then you think to yourself, does that sentence make sense or not? Or you can say, you can teach your client to use techniques that strengthen the sphincter and structural supports of the bladder, such as Kegel exercises, to prevent stress incontinence. So it doesn't really matter how you use those keywords as long as you take them and you make a new sentence and then you think about it. So hopefully you're saying, yes, that kind of makes a little bit of sense. Great. Then you do the same process for all the rest of your answer options. I encourage you when you're practicing to do it out loud, because hearing some of these statements that you're going to make can make it sound, oh, that sounds off. So then you don't choose it. Or there's something in there that sounds like it could be right, and then you would go with it. So let's do the next one. You could teach your client to avoid dietary irritants like caffeine and alcoholic beverages to prevent stress incontinence. Maybe you do, or maybe you don't know if that's right. When we go to the next slide, I'm going to have a slide about it. However, at this point in time, if you don't know if you should avoid them or not, I want you to do a technique called the switch technique. The switch technique is you literally take an answer option that you're on the fence about, like, oh, I don't know if I should do that or not, and you flip it to its opposite and you see, does the opposite make more sense for this question, or does what's there make more sense? So here's what I mean. The original says to avoid dietary irritants to prevent stress incontinence. Okay, what about if you restate it and say, teach your client to drink dietary irritants to prevent stress incontinence? Which one makes more sense? Should you drink dietary irritants to prevent stress incontinence, or should you avoid them to prevent stress incontinence? So see how that adds a lot of clarity? When you do the switch technique, I use this all the time. It's a secret. It's not a secret, but it's definitely something to keep up your sleeve. So it helps you really critical think and eliminate. So I probably should avoid dietary irritants instead of drink them to prevent stress incontinence. So I do like this answer option. And here's the next one. Teach your client not to laugh when in social gatherings to prevent stress incontinence. This is a perfect example of needing to know therapeutic communication. You have to know how to talk to people. If you tell someone don't laugh, usually when people get nervous, they laugh. So you're going to make them laugh because they're nervous because you told them not to laugh. And if they have stress incontinence, now you just made them pee their pants. Great job. So don't tell people not to laugh. Don't talk to people non-therapeutically. When you learn about therapeutic communication, you better pay attention because so much therapeutic communication is tied into exam questions. So we're not going to tell people don't laugh. What about this next one? Oh, my face is in the way here. So just, sorry, I'm blocking it. So teach your client to carry an extra incontinence pad when away from home to prevent stress incontinence, or to prevent stress incontinence, teach your client to carry an extra incontinence pad when away from home. Is that correct or not? Some people say yes, some people say no. The answer is no, it is not correct. And here's why. Does carrying an extra incontinence pad when you're not at home do this? No. That is why honing in on the keywords in your question are so important. If it does not prevent stress incontinence, it is not correct. This is so perfect of an example test question where you're going through a test and you feel good about it and you're doing it and you're, yeah, patting yourself on the back, and you get your grade and you're like, what kind of junky grade is that? It's not reflecting what I felt like when I was taking my test. It's because of questions and answer options like this. Because if you miss that word prevent, you're going to see, oh, somebody has stress incontinence. Yeah, you want to use an incontinence pad when away from home, but that's not answering your question. If it's not answering the specific question being asked, it's wrong. This is a prime example of how people can get questions wrong. So hopefully that is a huge learning point for you just in that answer option alone. Okay, so the last one here. Teach your client to obtain a fluid intake of 500 mLs daily. Now, this one has content in it, right? You either know that 500 mLs is too much, too little, or just right, just like what Goldilocks and the Three Bears with the porridge. So too hot, too cold, just right. Let's say you don't know. This would be one of the ones where you have to make a judgment call, or you have to lean on more of a trick strategy. So let's talk about it. If you didn't know, let's say you didn't know, you're like, I really don't know. I want you to use something called the absolute word strategy. And there's going to be a slide about it, and we're going to do another practice question, but I can't in advance or else it's going to cut off my recording. So absolute words are very definitive and harsh sounding words. They're very concrete, they're fixed, they're harsh sounding. Things like always, never, none, every, only, must, once, now. Those are like very definitive and concrete words. So I can try to see if that works here If I asked you, what does daily mean? Rephrase daily in your own words. What does it mean in a different way? What does daily mean? Hopefully you're saying every day. Daily means to do something every day. Okay, so let's rephrase it. To prevent stress incontinence, teach your client to obtain a fluid intake of 500 mLs every day. I don't like absolute words because they're so definitive, they're usually wrong. Like 90% of the time when you see them in answer options, they're wrong. Therefore, if I didn't know this answer option and I saw that daily as a everyday, I probably would eliminate it in the hopes that that strategy would help me get it correct. Is it always going to work? Absolutely not. Because it says always, and that's an absolute word. Is it always going to work? No, right? Because absolute words don't always work. However, that could be one way you could make your way through this question. So that's how I approach select all that apply questions. I do not group answers. I think of what are the keywords, and then I take those keywords and I make new sentences and I read each sentence individually. And once I decide whether I like it or not, I'm done with that part of the question and the answer option, and I don't turn around. So hopefully that was helpful for that. This is just an overview of what we've already talked about, the switch technique. So if you're eliminating answer options and you're unsure if you should or shouldn't do something, flip that answer option to its opposite and see if that makes more or less sense, and then make your judgment call from there. Here's a review of the absolute words that we were talking about. As a reminder, absolute words are very definitive, they're very concrete, they're usually extreme in meaning, they're fixed, they're not like, fluid. So why do they matter? Because probably 90% of the time when you see an answer option that has one of those words in there, it's probably wrong. I literally get blaring sirens and like I think I'm in a submarine and it's like everybody's running because there's orange lights going off and that's what I have in my brain when I see an absolute word, because the probability of them being correct is minimal. Most of the time when you see them, they're wrong. Sometimes, like 10% of the time, when you're reading an answer option and you see that there's one of those words in there, you might think, well, I kind of feel like that's correct. So it doesn't really go with what Mel was just talking about. However, if you look at that answer option that you do like that has an absolute word in there and you think, is this a safety issue? The probability of it being yes is there. If it's a safety issue and it includes an absolute word, it's probably right. So for example, never lift the Foley bag above the level of the bladder. Never do that. Because if I have a Foley bag and there's urine in it, and I lift it up above the bladder, what's going to happen to it? And it doesn't matter who has a Foley in. I don't care the type of patient that has it. I never do that, right? Or always do hand hygiene before and after you come in contact with your client. Always. I always do that because I don't want to bring something in their room and get them sick, and vice versa. So those time frames when you see those absolute words and you think they're correct is probably because it's a safety issue. Otherwise, the vast majority of time when you see those words, always, never, none, only, once, the rest of those, they're probably wrong. Let's practice an absolute word practice question. A nurse suspects the client has a paralytic ileus after identifying an absence of vowel sounds. Which of the following actions should the nurse do first? So we just read the question. What's the next part that we do? We do what? Read, recognize keywords, and then wrap. So what's the very important words in this question? I'm going to highlight. Let's do it in green, the important words. Go ahead and look at that question and think, if you had to underline or highlight the most important parts of that question, what would you do? So they have this potentially. Ooh, you can't really see that. We can get rid of that. Let's do yellow. Okay, you suspect they have a paralytic ileus after assessing, after finding an absence of vowel sounds. Which of the following actions do you do first? What do I do first? And then after I find those things, after assessing. So take a second now and wrap the question. What is that question actually specifically asking you? What is the core of that question? Rephrase it in your own words. I'm going to give you a second to try and do that. Okay, there's two things I want to talk about for wrapping this question. And we're going to focus in more on what I'm getting ready to say in a future slide. But anytime that you have a question that says, what action do you do first? It's a nursing process question because nurses do things. So which of the following actions should the nurse do first? If that was the only part of my question, I would say I'm going to assess something, right? Because ADPIE is a nursing process, ADPIE, and the first part of that is to assess. However, that is not the only part of this question. So because that part of the question is there, I'm going to have that lens of nursing process going on in my mind to help me eliminate answer options. That's really paramount to start noticing because it's going to help you eliminate things if you notice what part of the process you're in. So what part of the process are we in? It says, you suspect they have this medical problem after identifying an absence of bowel sounds, which means you did what? You assessed them. You assessed their bowel sounds. So I am done assessing. I've done that part of the process, which means if there's an answer option that's talking about assessing, I'm not going to choose it because nurses don't assess and then reassess. We assess and then we do things. So if you're just briefly going to be looking at some of these answer options, when we're going through there, keep that in mind of, hey, if we're not in the right part of the nursing process, we can get rid of those answer options. That's a really big test taking tip. However, if you notice that somebody might be having a paralytic ileus, what do? What's the first thing that you can do to help somebody if they have a paralytic ileus? That's how I would rephrase that question. If somebody had a paralytic ileus, what do I do as a nurse? And then I think about it. What would I do? And if you've been through med-surg, you have an idea of what you might do. But we're going to read every single answer option and look for some of those absolute words to help us eliminate. So it says, notify the physician immediately. Are there any of those harsh or absolute words in that one? Notify the physician immediately. Immediately do that. So this word immediately here makes me not really like that answer option, because what can I do as a nurse for this person? I can do something for them before I go call the doctor. So the word immediately there is very harsh sounding. It's kind of, really intense. So I'm going to probably not choose that one if I had no idea what a paralytic ileus was. So the next one says ambulate the client. Remember, we're in the part of the nursing process where we can do things, right? Because we identified in the question that they have already assessed. So that might be something that I can do if I like that answer option. If you've done med-surg already, you're probably thinking, yeah, that's probably the right thing to do. So the first one we don't like because of the absolute word there. This one is a probable, but we're gonna, read all of them. We always read all of the answer options. This one here says, request a one-time dose of morphine for the pain. Are there any of those absolute words in there or harsh sounding things? A one-time dose. So do it once, only one time, right? Because that word is there. If I had no idea about a paralytic ileus and I didn't know what morphine was, I could say, well, one-time dose is kind of absolute wordy, so I could get rid of that answer option. If you know your nursing content, you're going to be like, well, paralytic ileus and morphine are probably a bad pair to do because morphine can slow down peristalsis and cause a paralytic ileus. So this medication is a bad idea in general. And just to show you how important reading is, this question is talking about a paralytic ileus, right? And even if you didn't know what that was, you took AMP and you know that ileus is part of your bowel. And paralytic sounds like paralyzed. So a paralyzed bowel are we talking about pain right now? Absolutely not. We're not talking about pain. So this answer option is answering a totally different question. It's literally has nothing to do right now with this other than the fact that it's identifying that you should know not to give morphine if they are in pain for whatever reason, right? So this answer option is answering a totally different question. Just throwing that out there. So I don't choose this one because of the one time. Kind of sounds like a harsher absolute word. And then the last answer option is to assess. Now, remember what we talked about. Are we in the assessment phase of the nursing process? No, we are not, because we have identified an absence of bowel sounds, which means we've already assessed, and now it's asking us to do something. So even if I liked what was there, I'm not going to choose it. Even if it's a correct assessment that I could have done, I'm not going to choose it if that is not the part of the process that I am in. That is a big thing. I'm not going to assess. I've already done it. Add pi is not assess to assess and then assess again. It's assess. And we've already kind of figured out what's going on, and I need to intervene. I need to do things now. However, let's say I missed that. This word here, if I didn't know anything about anything, has an absolute word. Every is an absolute word. Therefore, I probably would be hesitant to pick it. I would probably eliminate it. Therefore, my answer on this one is to ambulate the client. Hopefully, walking through that showed you how you could interpret questions, how you can work through nursing process, how you can use absolute words. Keywords are extremely important to start noticing. So what are keywords? Keywords are usually strategic words that can increase or decrease the importance of something or a scenario. They usually revolve around timing and priority. So for example, some timing things. Let's say in the question it says you have an early onset of something, or you're doing the initial assessment, or after you did this, or I just started that, or suddenly something changed, or I have a new onset of something. So see, those are some of the words that can revolve around timing. Those can also be in your answer options, and they usually are in both the question and the answer options. Some things revolving around priority keywords would be highest and lowest importance, most or least, what's the primary thing, vital, the word vital, what is essential, acute and chronic. Sometimes it literally just says priority. Sometimes it says emergency or an exacerbation. So really try to hone in and notice these words. They're really important to eliminating or choosing answer options and identifying what's actually happening in your question. Before we move on, and before we do a practice question, I wanted to quickly chat about the words most and first. These are keywords that were on the previous slide. I can tell you from my experience doing exam reviews with students, when you see the word most or first in a test question, that generally tends to cause students to get very anxious. And they don't even realize it's because of those words. It's when they start reading the answer options, they are seeing more than one answer option that they like, and that gives them anxiety. Well, here's a tip. If you see the word most in a test question, you are supposed to like more than one answer option. So if you think of that right off the bat and say, okay, this question has the word most in it, that means I'm going to have to make a judgment call. That means I'm going to like more than one answer option. Knowing that in advance, then when you read those answer options, you're not going to be so freaked out that you like more than one. It's going to be a comfort to you because you're going to say, oh, okay, well, I like those too. And it says the word most in the question. Now what you have to do is say which one is literally more important than the other. Which one related to the question fits better. I like to use safety and ABC. In my mind, I think, okay, is one of them related to airway, breathing, circulation, or safety? I really hone in on what is the question specifically asking, because that helps me eliminate answer options. I'm absolutely wrapping the answer options to say, okay, I like these too. However, which one do I think is more correct than the other if I had to choose it based on what the question is asking? And the word first, if you're thinking about what do I do first, you're going to see things that you like. Most of the time they're going to have more than one answer option that you like. Just know that that's okay. When you see the word first, I want you to think about the nursing process, just like that practice question we just did. What do you do first? Well, hold on, let me go and look and see what part of the nursing process that I'm in, and then I can eliminate answer options after that. So be okay with liking more than one answer option when you see these words in your test question. It will definitely reduce anxiety as you're doing that question. So let's do a practice question. A nurse is assigned a client recently diagnosed with tuberculosis. Which of the following is the most important intervention to ensure safety? Don't look at your answer options. Remember, we're going to read, recognize, and then wrap. So I want you to go recognize those keywords in the question. I'm going to give you a second to do that, and then I want you to wrap it in terms of what is it really asking. So go ahead and do that. Okay, so I'm going to start underlining things that I think are important. I have this timing thing here, recently diagnosed, so a new diagnosis of tuberculosis. I may or may not know what that is. Which of the following is the most important thing to do to ensure safety? What is this question really asking us now? Rephrase it in your own words. Don't use the same words. If I want to keep people safe, what do I do if the client has tuberculosis? Or if the client has tuberculosis, how do I ensure safety? How do I keep people safe? What's the most important thing? Remember, the word most is in there, so you're probably going to like more than one answer option. Just keep that in the back of your mind. So if you know the content about tuberculosis, you could say, okay, I would do X, Y, and Z to make sure that there's things safety-wise going on. But my core of my question is, my client has tuberculosis and I need to ensure safety. I always come back to that. And then when I have most important, I make a judgment call. I'm going to have to make a judgment call. Okay, so here's the judgment calls. Let's start. Place the client in a room with a roommate to prevent feelings of isolation. Now, when I'm talking about the most important thing to do, whenever I see that phrasing, I like to think, what's the safety thing? What's the most critical thing to worry about? Are your feelings the most critical thing to worry about when you're dealing with patient care? Not generally speaking, right? ABC is safety. That's what the most important thing is. So is this answer option ensuring safety? No, we are not. It's dealing with feelings of isolation. That's something that I would want to do for that client. However, that is not ensuring safety, and nor, even if it was something that ensured safety, feelings, when I have to prioritize, are on the end of my list, and we're going to talk about that more later. So this is probably wrong. What about ensure the client is in a positive pressure room? So a positive pressure room describes the type of room. So anytime they give you a descriptor, it's important to look at. We're going to come back to descriptors in a couple of slides, or maybe in the next slide, I can't remember which one. So this is something you need to know. Does a positive pressure room or a negative pressure room go with tuberculosis? And if that's the case, does that ensure safety? Which one ensures safety, a positive pressure room or a negative pressure room? So this could be an answer if positive pressure is correct. What about immediately? That's a timing thing. Immediately conduct a focused respiratory assessment. So a focused respiratory assessment is another descriptive thing about the type of assessment you're going to do. Does doing an assessment ensure safety? Or does doing things other than assessments ensure safety? You know, it's important to know how to do your plan of care with good assessment. However, your plan of care is what ensures safety, not doing the assessment. So I would get rid of this because we're not talking about that part of the process. We're talking about doing things, not assessing things. So I would probably get rid of that. And even if I didn't know and focus on the nursing process part of things, the word immediately is very harsh and absolute. So I don't really like that. And it's definitely a key word that I can focus on too. And then the last one here, don an N95 mask. So they're telling you the type of mask, just like the type of respiratory assessment and the type of room. Before is a key word for timing. I go into the room. So when you have keywords, you need to focus on that. What does that mean for that client? Put on an N95 mask, or if you just didn't even focus on N95 mask, put your mask on before you go in the room or after you go in the room. See how we did the switch technique there? That's another way that you can help have clarity. So you may or may not know about the positive pressure room, right? Maybe you learned about that, maybe you didn't. But probably in your very early nursing school classes, you learned that if you need to put a mask on, you do it before you go in their room rather than after you get in there, right? Because if you put, especially with airborne, and everybody is dealing with COVID these days right now, so we know airborne, you put the mask on before you go in the room, prior to. That is the most important thing to ensure safety. Not their feelings, not doing your assessment, not putting them in a positive pressure room. It's a negative pressure room, by the way, but you know, we're trying to figure out here, you know for certain you put your mask on before you go in the room. That is how you could make your way through that question. When we were working through the last question, we talked briefly about descriptors. Descriptors are one of my favorite things to talk about for test taking because they are literally everywhere. If you've never purposefully looked for them, after we get done with this presentation and you go look at test questions, you're going to see descriptors literally everywhere. And descriptors are huge clues. Clues for you to choose an answer option or clues for you to eliminate an answer option. So descriptors describe something or someone, kind of like adjectives. Let's see. They make things more specific. Whenever you see a descriptor, I want you to think, why would they give me this? Why would they describe something extra? Why does this matter? So for example, let's go to the next slide and I'll show you some descriptors. The first type of descriptors are direct. They're very clearly and overtly stated. They basically make it so that you can very easily see, okay, this type of client, a client with this religious affiliation, a specific age range, a specific type of anything. Anytime they make something more specific, that's a descriptor that helps you choose or eliminate answer options. For example, I could just say a dietary choice of chicken, and that's just chicken, chicken is chicken. But if I add the word fried chicken to before the word chicken, now I'm thinking, okay, that's high fat. Or a sustained release tablet versus just saying a tablet. What if my client has a G-tube? Should I be giving them sustained release tablets through a G-tube? Right? So those give you clues. They're very overtly stated. You're going to see them if you know to look for them. These are the ones that will be missed if you're going to miss descriptors, the indirect ones. Indirect descriptors are not clearly stated and they are not very overt. They're very covert. You have to dig. You must wrap your answer options to notice these, to find these. When you're looking at each answer option and you're asking yourself, what could this answer option mean? You're wrapping that and you're helping yourself determine if there's any indirect descriptors in that answer option. So for example, I've given you their water. Let's say your answer option includes that they're asking for water. Well, what is water related to your scenario? If your scenario is you have a client recently diagnosed with a stroke and they're thirsty, should they be having water? Especially if they have dysphagia, right? So thinking about what could water mean related to the scenario? Or another example, if let's just say it says give somebody morphine. What is morphine? Should they be having morphine? Does the client already have an existing respiratory issue with low respirations? If so, I'm not going to give it to them. Or if I haven't checked their respiratory status, or if they're already having a lot of complications that everything is really slowed down, probably morphine as a narcotic is not the best idea, but I'm not going to know that unless I wrap those answer options. It's so important. So let's practice. A nurse is assigned a female adolescent client admitted with bacterial meningitis. After initiating droplet precautions, what is the priority nursing action? I want you to, we just read it, now you need to recognize the keywords and then wrap it. What's the question asking? So what are those keywords? What's the important words here? We have a descriptor here, female, then we have an age range. So this is a big key that's going to come into play at some point as we're evaluating answer options. They don't give it to you for no reason. They're admitted with this problem, and that's a descriptor of the type of meningitis. So bacterial meningitis, because there's viral meningitis. We initiated this type of precaution, so they're telling us what type of precautions. That's another descriptor. And then they want us to know what's the priority action. So it's nursing process as well. So what is this question asking us? So if you have to do something for a female adolescent client with meningitis, what's the most important thing that you're going to do first? We already have everybody safe. We already initiated droplet precautions. So what part of the nursing process am I in? Am I in the assessment or the intervention part? I'm in the assessment part. All I did so far was ensure safety with initiating the type of precaution. So I have to assess my client. So anything that's not an assessment, I'm getting rid of. Because even if it's the correct thing to do for this client, I'm not going to choose it because I don't skip steps of the nursing process. So the first one here is administering antibiotics. I don't even care that that's right or wrong if I'm supposed to or not supposed to do it. It's the wrong part of the process. I'm not going to skip parts of the process. So yes, IV antibiotics is what you will be giving to a bacterial meningitis client for treatment. However, I'm not in that part of the process, so I'm going to get rid of that. So they're giving you descriptors here just so I can show you IV antibiotics, and the treatment is antibiotics. So this is an indirect descriptor. Antibiotics is a type of treatment that works with bacterial meningitis. However, because I'm not specifically asking what do I do, I'm asking more like what's the intervention I'm doing an assessment part. This is wrong just because it's not the right time. What about conducting a complete head to toe? So a complete head to toe assessment is, they could have just said conduct an assessment. Now they're saying complete head to toe assessment. Does that go with bacterial meningitis, or should you do a focused focused neuro assessment? Meningitis. You may or may not know what meningitis is, but I kind of gave you a little clue that it's a neurological thing. Okay. Determine the client's first day of their last menses. So just as a side note here, the second one is an assessment, so I have to consider that as a possibility, just like I have to consider determining the client's first day of their last menses. That's an assessment. You're assessing the last day of their first period, or the first day of their last period. So the first day of their last period, does that relate back to a female adolescent? See how that really ties in? What are they really getting at there? This is a very indirect descriptor. What could the first day of their last period be getting at? That's how I need to ask myself that question. That means I'm assessing if they're pregnant or not. Could a female adolescent be pregnant? Absolutely. So see how that descriptor in the question relates to the descriptors, the indirect descriptors in this answer option. That's a very high likelihood. Plus it's an it's an assessment, so that's even better. So what about dimming the room lights for the client's photosensitivity? We're not assessing in this answer option, that's doing something. This is something that's nice to do for somebody with meningitis because they're gonna have photophobia and headaches, and it's gonna be very uncomfortable for them. However, I'm in the assessment part. So now that you have to choose between this one and this one, when you see what's the priority, I always want you to think safety, ABCs. What's the most important, safest thing for this client is to make sure they're not pregnant. Because if the baby gets harmed because you have an antibiotic that can harm the baby, that's a huge, huge problem versus doing a complete head to toe when you can do a focused assessment. So this would be your answer option and how you can use descriptors, both direct and indirect, to make your way to the correct answer. We've hit on nursing process several times throughout this presentation already, but I have its own slide just to make sure that we're very clear that this is a huge that this is a huge test taking strategy, not just something you're going to do in the clinical setting. So anytime it's a question that talks about doing something, what action should you take, what's the intervention that you need to do, how do you respond, I want you to think this is a nursing process question. Then I want you to figure out what part of the process am I in, and then you can eliminate answer options if it's not talking about being in that part of the process. It's that simple. This is the most underutilized test taking strategy in the history of like nursing school. I always see students miss this because they don't know to look for it. Once you know to look for it, you can just slice and dice your answer options, because if you're not in that part of the process, you can just automatically get rid of it. So let's try again. A client with a deep vein thrombosis suddenly develops dyspnea, tachypnea, and chest discomfort. What should the nurse do first? Don't look at your answer options. What are the important words in that question? Recognize those important words. DVT, right? I suddenly, there's a timing word. Get all of these things, dyspnea, tachypnea, and chest discomfort. What do I do first? So there's the nursing process aspect of things. What's our question specifically asking now? Wrap that question in your own words. What part of the process are we in? Are we in the assessment phase, or are we intervening? What do you think? Should we assess now, or should we intervene? We have already assessed. Here's why. You suddenly develop dyspnea, tachypnea, and chest discomfort. How do I know they have this? How do I know they have that? Just randomly know that? Nope. I counted respirations, and the respirations are too fast. Therefore, that's what that word means, is the respirations are too fast. If I identify the respirations are too fast, that means I've assessed. So I'm done assessing. I have to do something now. So I'm going to eliminate anything that's an assessment. Even if I like it, it's not saying which of the following assessment data would you like to include in your initial assessment. Nope, it's saying you've assessed, now do something for this client with a DVT who is having respiratory issues. So if my client is having issues with respiratory problem, like if I have a DVT and now I have respiratory issues and chest pain, what's the first thing I need to do? Okay, so elevate the head of the bed 30 to 45 degrees. Is it doing something? So that's a possibility. Encouraging the client to cough and deep breathe, that's doing something. Auscultating is an assessment. I'm not even going to read the rest of it because I'm not going to auscultate. I'm not in the assessment phase. I've already done that. And then contacting the physician, that's a possibility as well. Let me pause for a second and talk about contacting the doctor. When you see contact the physician, you need to think, do I have enough information to do SBAR, communication with them? Can I give that physician the entire picture of what's happening and my recommendation? If not, you're not calling the doctor. Also, if there's something you can do as a nurse, as an independent nursing intervention that you can do before you leave the room, do it. Don't just run out of the room and call a doc. Let's say, for example, you go into a client's room and the bed sheets are saturated with blood because they're post-op and there's some issue, obviously, with the incision, they're bleeding out. Do you go call the doctor, leave the room, and be like, okay, I'm going to go page the doctor? Or do you put pressure on that wound and then, press the call light and get some help? What do? You put pressure. So if there's something you can do, do that before you call the doctor. So in this case, is there something I could probably do before I go call the doc? Absolutely. So I'm going to get rid of that answer option. Those are the questions I ask myself. So keep that in the back of your mind. I don't have a slide about that. So anytime you've narrowed down, I want you to think, what is that question really getting at? What is the question specifically asking? What's the first thing I should do if somebody's having respiratory problems? Hopefully you're saying sit them up. It's an easy thing, non-invasive, quick, sit them up, elevate the head of the bed. Anytime you see the answer option that says elevate the head of the bed, I want you to assume they're supine, laying flat. And when you're laying flat, gravity is pushing down on your chest and making it hard for you to inhale. However, when you sit them up, gravity allows the diaphragm to go down. I can get a better inhale because gravity pushes the diaphragm down easier. Now I have a good inhale and I'm helping that client breathe better. So I really like this as my main answer here. And telling them, encouraging them to cough and deep breathe, it's saying they have dyspnea. They cannot do this deep breathing. So that kind of is a way that you can eliminate that too. So just based on nursing process alone, the third answer option is out. Then asking myself those questions about the doctor or the physician, primary care provider, whatever you want to call them, it's not time because I can do something on my own, and sitting them up helps immediately with respiratory issues. Let's talk priority setting. How do we know that it's even a priority setting question? So there are some key words that I don't have written down on the slide that we've talked about earlier. So the key words on the timing and priority, go back to that slide and look at those. If those words, immediate, new onset, all of these really intense, new admission, emergency room, post-op, those are keywords in the question that should have, some sirens going off saying, I need to prioritize my clients. And then you have to ask yourself, okay, if I do need to do that, how do I do that properly? So you guys have learned ABCs and Maslow's hierarchy of needs. So Maslow's hierarchy of needs, at the bottom here, you've got the breathing, airway breathing, and then homeostasis. So if you think ABCs, that's the bottom of your pyramid here. Your ABCs is the bottom pyramid. Then safety is the second tier. So I'm going to flip to this next slide and show you how do I prioritize. I have a system that I do. When I'm prioritizing, this is the most important thing to think about: your airway, your breathing, your circulation, and then your safety. And it's in that order because when you think of the Maslow's triangle, the very bottom core of everything is your ABCs. ABC, airway, breathing, circulation, and then the second tier is safety. So you can prioritize in that way almost every time. So I'm worried most about these issues. If I cannot relate it to an ABC or an S, I'm going to worry about pain because pain can influence the ABCs. And then I'm going to worry about their feelings and teaching them and them coping and all of that stuff. In terms of priority, if I have to prioritize, I don't care about your feelings or teaching you things or how you're coping. I care about you. I am a holistic nurse. But in priority situations, your feelings go by the wayside, and I deal with your ABCs and pain in that order. So let's show you how we do it. The nurse is admitting a client with acute appendicitis to the emergency department. The client has abdominal pain of 10 on a scale of 1 to 10. The client will be going to surgery as soon as possible. The nurse should. So do not look at those answer options. There's a lot to unpack in this question, and we'll do it together. I'm not going to wait to have you do it on your own. Here are some of the things in the test question that make me think I need to think priority. The nurse is admitting. Anytime you have to admit someone, they're unstable. And then you say acute appendicitis. Acute things make me want to think about priority versus chronic things. And then I say they're in the emergency department, which is a good indicator that they're unstable and that they need to be prioritized. And then you're giving the most high amount of pain that I can rate on a scale of 1 to 10, and they're going to surgery as soon as possible. So this test question is screaming to prioritize. So with that being said, what do I do? What do I do in this question? Is this something that I can do nursing process with? I kind of feel like I already assessed, right? I got a 10 out of 10 pain, which means I asked them questions. So if there's assessments there, I probably could get rid of them. If there's no assessments there, I have to make, judgment calls on what I need to do. But if this is the situation, I need to worry about ABCs. Let's say ABCs is category 1. So ABCs would be category 1, pain would be category 2, and category 3 would be those safety, feelings, coping, well-being, educating. If you have an airway, a breathing, or a circulation thing for category 1, you can even say like an A for airway or a B for breathing. All I do is I look at these answer options now and I determine whoever's closest to an airway issue wins the answer. So contact the surgeon to request an order for a narcotic for the pain. If I had to decide what category that goes into, is that the ABCs, is that pain, or is that your feelings, coping, education, well-being? We're talking about pain, right? So that goes in category 2 because category 2 from that previous slide was pain. What about maintain the client in a recumbent position or in a comfortable position? We're talking about comfort. You could possibly relate it to the second category, but this one probably is more along the lines of the third category. But even if you put a 2 there, you're still tied with the first answer option. What about placing the client on an NPO status, a nothing by mouth status? What category could that go into? And that is really an indirect descriptor. You have to ask yourself, what on earth could that mean related to my question? If you don't ask yourself what that can mean, you might get this one wrong. But if you have a client that's going to surgery ASAP, do you want them to be NPO? Yes or no? And if you do want them to be NPO, why do you want them to be NPO? And hopefully you're saying, well, if they eat a cheeseburger right before surgery and then they go get intubated, they could aspirate. So that would be a number 1 category. But even so, it would be an airway part. So I'm going to put A for airway there, which means the category 1 makes me eliminate these 2 answer options because I want to choose the thing that's closest to an airway issue as my winner of this question as the answer option. So this is a high likelihood that that's the correct answer, but let's look at the last one. You have apply heat to the abdomen in the area of the pain. So we're talking about pain again. Pain was category 2. And even if you had no idea that you are definitely not supposed to do that because you're going to burst the appendix, it's talking about pain, therefore it's a category 2. A category 1, especially an airway, beats a category 2. So here's your answer. This is something you're going to see on your NCLEX a lot, especially in your senior level nursing courses. So the last tip was about prioritization, just in general. And it's most of the time you can go through what we talked about. There are going to be situations where it doesn't apply, and you're going to learn those as you go throughout. However, this is a little bit different. This is the type of question where you have to choose who is the highest priority client that you need to go see first or that you give to the most experienced nurse. Or it's a reverse prioritization where you need to figure out who's the least priority. So who do you discharge? Who do you give to the nurse who's floating to the unit? Who can I delegate things for? Who can have the nurse be a new grad? So you have to pay attention to the phrasing because you need to really identify, am I supposed to do the highest priority client or the lowest priority client for these types of questions? When you have to prioritize clients, they usually give you a 2-part answer option format. The beginning part is usually the case scenario, which gives the client their background. And the second part is the modifying phrase, which is the part to really pay attention to because that's the part that reduces or increases priority level for the case scenario. So for example, down here at the bottom, you have a 16-year-old client arriving via ambulance after a motor vehicle accident. That is your case scenario. The modifying phrase comes after that with multiple lacerations to the face and body and ipsilateral pupil dilation. That's the part that increases or decreases the priority setting for the 16-year-old client arriving via ambulance after a crash. If I had the same exact case scenario, a 16-year-old client arriving via ambulance after an MVA, and the modifying phrase was who is resting comfortably, who is more of a priority? And why are they more of a priority? This person that is in this written one here, or the one I just said? Of course it's the one that's written down here. So the important thing that I changed was that modifying phrase. You must hone in and look at that modifying phrase to determine who is more of a priority patient. And we're going to walk through how to do that. There are some really key things to think about when you're deciding on who the priority client is. First of all, you can have all airway issue clients or all breathing issue clients or clients with circulatory issues. So as a first line option, I'm not going to use that technique of, whoever has the airway issue is the correct answer, because they could give you 4 people with the same type of issue. So that's not initially what you're going to be looking at. Your most urgent patient is your highest priority patient. That urgent client is the number one. The next slide is going to talk about how do you determine urgency. You're not ever going to prioritize solely on someone's age or gender. If that's the only thing you're looking at, you cannot say this person is more valuable than this person based on a gender or an age. Do not do that. You can use that information to help look at the scenario, but based on that alone, you will never ever prioritize based on that. You're going to definitely use Maslow's hierarchy of needs to help you with these questions, and you're going to pay attention to trends. Trends very much matter. And when you're trying to figure out, let's say you like 2 different answer options, I want you to focus on using the lens of, I need to pay attention to the actual obvious stated problems versus ones that are potential problems, or ones that could be problems, but I need more information. So when you're trying to break a tie, the tiebreaker, you can pull in your ABCs and you can pull in your actual stated problems versus potential ones. So for me to help you remember how somebody can be urgent, I created something called urgency vowels. So normal vowels are A, E, I, O, U. The urgency vowels are A, E, I, C, U, because the ICU is, high stakes. So when I proceed through this slide, everything on the left-hand side are your urgency vowels, and the right side, underneath the green heading, are opposite of your urgency vowels of what makes you less urgent. So the more urgency vowels someone has, the more urgent they are. So for example, if I have somebody that has an acute situation versus a chronic situation, they're more urgent. If somebody is newly admitted or has been admitted and it's within that first 24 hours, they're more urgent than somebody who's been in the hospital for a while. If you're doing an apical pulse, if they've had general or intrathecal, like into the CNS anesthesia, if you need to give an antidote. So those all start with an A. Emergency, if they're saying there's an emergency, or if they're in the emergency room, or if they've had emergency surgery. If it says there's an exacerbation of something, that's the E for urgency, urgency vowels. If it says they're immediate post-op, especially within that first 12 hours after surgery, if it says there's an immediate assessment that's indicated, or if there's an immediate safety risk, that's the I part of your urgency vowels. Those make people more urgent. If there's a change in their condition, if they're experiencing complications, or if there's critical lab values, that's the C part of your urgency vowels. Those make somebody more urgent as well. And then the U part is if it literally just says they're unstable, or if they're experiencing unexpected or uncommon findings. So let me give you an example of that. That doesn't mean that they're experiencing a complication of something. So let's say I have a client who has pneumonia. A complication of pneumonia is atelectasis. So I could say atelectasis is a complication. However, if I have a client with pneumonia who is now starting to experience and exhibiting slurred speech and weakness in the extremities on one side of their body, that is absolutely not correlating with somebody with pneumonia. That is not a complication of pneumonia. That is unrelated, a new thing. That is an unexpected or uncommon finding with pneumonia. Therefore, that is a very high likelihood that that is the urgent patient that you need to go see. So the next slide is going to tell you the process of things, but the urgency vowels that are here help you determine the level of urgency. The more they have the urgency vowels, the higher the likely they are to be the person that you need to go see first. So here's the process. here's what we do. You're always going to identify if you're supposed to see the highest priority client or look for the highest priority or the lowest priority. You need to evaluate the phrasing really carefully. After you know what you're supposed to do, you're going to look at each answer option individually. The more urgency vowels present, the higher the likelihood that they are the client that needs to be prioritized. You have to focus on the modifying phrase. The modifying phrase is really what changes everything. And then to break ties, let's say you like two different ones, pull out those ABCs, identify clear, overt, stated actual problems versus potential ones. People who have more ABCs or actual problems, you're going to prioritize them. There's always going to be quirks and little things that make it unique, like for example, increased intracranial pressure. An expected finding of that still is extremely urgent, or a client who has a myocardial infarction, an expected finding of that is chest pain. That is a high priority thing to deal with. So as you learn content, you're going to learn which things kind of fall off the urgency thing in terms of what we talked about on the previous slide, but you can take on the previous slide with you, and in most situations that's going to help you prioritize. Let's put the pieces together. The charge nurse is making shift assignments for the medical floor. Which client should be assigned to the most experienced nurse? Do not look at your answer options yet. Should we choose the highest priority client for this answer, or should we choose the lowest priority client for this answer? What do you think? It says to choose to give it to the most experienced nurse, which means you need somebody who knows what they're doing. So you want to choose the highest priority client for your answer for this, based on this phrasing. So now that we have our urgency vowels from the previous slide, let's go through and look at this. So I'm going to highlight the case scenario in yellow, and then we'll put the modifying phrase in a different color. So the client diagnosed with congestive heart failure. Congestive heart failure, is that an acute or a chronic issue? That's a chronic issue, right? So keep that in the back of your mind. Chronic issues are not as urgent, but now here's our case scenario. Our modifying phrase, who is being discharged in the morning. So the client diagnosed with CHF who is going home tomorrow or in the morning. Is this patient urgent? No. They're going home, which means they're stable. They have a chronic illness, congestive heart failure. So this I can pretty well say is not going to be our answer. We're going to do the same thing for the next one. A client with a history of fecal incontinence who is diagnosed with food poisoning. That's our STEM, that's our case scenario. And here's our modifying phrase. And they're having frequent bowel movements and vomiting. Okay, so we have now an acute issue of food poisoning, a history of fecal incontinence, frequent bowel movements, and vomiting. You must wrap your answer options when you're working through these types of questions. So they have an acute onset of something. That's something to be concerned about, food poisoning. However, if you are having food poisoning and I had to say to you, what are probably some symptoms you would have with food poisoning? You would probably say, well, you'd probably be having a lot of diarrhea and vomiting. Okay, so this means they're having an expected finding of an acute illness. Yes, they're at risk for skin breakdown. They have some risk factors for skin breakdown because of frequent bowel movements and incontinence, and they're at risk for fluid and electrolyte imbalances, but they do not say right now that that is occurring. You cannot insert extra information. As of right now, this is saying you have a client who is experiencing a common finding of food poisoning, period. So this is probably not the answer, but we will keep this in the back of their mind. But I want you to think about how I just rationalized through that. Here's the next one. The case scenario is or let's just read it because it's backwards. The client with an apical pulse rate of 160, respirations of 27, and blood pressure of 92/60, who is 5 hours postoperative. 5 hours postoperative is your case scenario, and your modifying phrase is they've got an apical pulse of 160, respirs of 27, and a blood pressure of 92. So it's flip-flopped on this answer option. It's kind of sitting backwards here. But let's look and evaluate what we have. We have an apical pulse. That was one of our AEICU things. And we have abnormal lab values, abnormal vital signs, 160, heart rate of 160, so that's tachycardia. We have tachypnea, and we have hypotension. So, should I be having all of these problems vital sign-wise if I'm postoperative? No. I also have, they are within 5 hours post-op. If I'm within 12 hours post-op, that is always a higher risk situation. So this has a lot of urgency vowels going on, and the modifying phrase is giving me some abnormal vital signs. So I've got ABCs along with 2 different urgency vowels. So this is very likely the situation, and this is an actual problem. I have overtly stated this is a problem. I have these abnormal vital signs. This one here now doesn't seem like it's as much of a priority because it's expected finding of a disease process, and I have some risk factors for things to go wrong, so I'm going to eliminate this answer option because this one so far is more urgent. Let's look at this last one. Our case scenario, the client diagnosed with pneumonia, and our modifying phrase, who is complaining of pleuritic chest pain and a productive cough with yellow sputum. So pneumonia is acute, which is important to keep in mind. It's acute. So far, we've got acute on all 3 of these, right? We have a client diagnosed with pneumonia. Can pleurisy, a productive cough, and sputum be an expected finding of pneumonia? I would say yes. That is an expected finding of pneumonia. That is expected. Is it good? No. Does it put that person at risk for other things? Absolutely, especially atelectasis. However, if I was to say to you, hey, you've got pneumonia, what do you think is going to be, what's going on with your client? I would say these are common findings. So this then is probably not the right answer, which makes the 3rd answer option your highest priority client. That client has lots of urgency vowels, has unexpected findings for post-op, they're doing an apical pulse, they're within 12 hours post-op, all of the vital signs are abnormal, it's unexpected, it's acute, it's urgent. Everything leading up to right now has been strategies that you can use while studying, while practicing, while testing, and actually during nursing practice. What we're going to talk about now are the strategies that you can implement if you are at a complete loss, if you are just going to wildly guess or do eeny, meeny, miny, mo. Use one of these strategies. However, they should never be the main approach to you doing test questions. They're not always going to lead you in the right direction, but statistically you have a higher chance of getting things correct while guessing and making educated decisions by using these strategies. The first strategy is the opposite strategy. So when you see answer options that are opposite of each other, that's the test maker saying one of those is probably correct, and it helps you eliminate the other answer options. So if you see answer options that are opposite of each other and you have no idea what the answer is and you're stuck, just like we talked about in the last slide, see if there's 2 opposing concepts and choose one of them. So for example, a common abnormal laboratory result associated with the development of peripheral vascular disease is. So that's our question. Let's wrap it and recognize keywords. We're looking for an abnormal lab result for PVD. So what kind of labs would make me think of somebody developing PVD? you may or may not know. Let's say you haven't learned it yet. You're in the fundamental classes, you've just started intro to nursing, you have no idea. I can go through and say, okay, high serum calcium level, high serum lipid level, low serum potassium level, or low serum lipid level. Which two are your opposites in your answer options? Hopefully you're saying a high lipid and a low lipid. If that's the case and you see answer options that are opposite, I would get rid of those two and choose between the lipids. And let me just pause for a second and say, if you have a client that has a disease and you don't know what that disease is, but it says it's a disease, and you think, okay, I really don't know what that is, don't get hiccuped on that PVD that you don't know. I want you to look at that. What is a lipid? You went to anatomy and phys class to be in nursing school. What is a lipid? A lipid is a fat, right? So when I'm stuck, I take a step back from things and I say, okay, I can pull from A and P and say, at least I know that lipids are fats. And I do know that that says it's a disease. So do I think it's more likely that high fat or low fat causes disease? What do you think? Do you think it's more common that high fat or low fat causes diseases in clients? Hopefully you're saying high fat is more likely to cause disease. If you were to go that route, you would get that answer correct. So when in doubt, lean on your anatomy and phys and make educated decisions by eliminating things that are not opposites. Another last resort strategy is getting rid of things that say the same thing. So if you've ever done a test and you've answered questions before and you leave and you're like, oh my gosh, that one test question had like the same answers for a couple of them. If the answer options are saying pretty much the same thing, that's the clue that they're probably both wrong, and I would get rid of them. So here's an example. Oh no, my face is in the way for this one again. A client who has had ulcerative colitis has persistent diarrhea. He's thin and has lost 12 pounds since the exacerbation began. Which of the following will be most effective in helping the client meet his nutritional needs? Now, what is this question asking? What are the key words? What's the question? What's going to be most effective helping the client meet nutritional needs if they have ulcerative colitis? If I have ulcerative colitis, what's the most effective method? Which means I'm going to like more than one answer option. So that's okay. Remember how we talked about that. And I'm going to try to show you the same technique and how far-fetched this can go. So hang tight with me here. You have continuous enteral feedings. It says enteral feedings. Following a high calorie, high protein diet. When you are eating food that is going through the enteral route. Enters the GI tract at some point. Okay, that's how I remember that. The next one is total parenteral nutrition. So I have an enteral, a parenteral, and then eating 6 small meals a day. If I'm eating things, that's the enteral route. So if I didn't know about ulcerative colitis, and if I didn't know how to most effectively meet this client's nutritional needs, I can eliminate things that are the same, which would be the things that are the enteral route, and choose the odd one out. So it's not as easy to see. Sometimes they'll do this with meds as well. This is harder to find. If you see that and you're stuck, that's something that you can use up your sleeve. This tends to blow the minds of senior level students when they find out that this is a thing. Remember, the previous 2 strategies and this one are not to be used as a first line defense on, approaching test questions. They will lead you in the wrong direction if you use them all the time as like the first thing you're going to do. However, if you're going to do eeny, meeny, miny, mo and just wildly guess at something because you really just don't know the answer, I want you to look at your question and see, are there any words or phrases in my question that are repeating in any of the answer options that I still like? If the answer is yes, choose the answer option that has more repeating words or repeating phrases. Let's try this one out. After a transurethral prostatic resection, a client returns to the unit with an indwelling urinary catheter attached to a continuous bladder irrigating system. Which nursing intervention may help prevent bladder spasms? Do not look at your answer options. What is the question getting at? So let's identify keywords and then I want you to wrap it. So we have, after this procedure, I've got a catheter and I've got this irrigating system, and that's a lot of words, right? What's the core of this question? What do I do to help prevent bladder spasms? Ooh, I don't like the way that showed up. I want to do this after that problem or that procedure, right? How do I prevent bladder spasms after that procedure? So now I'm going to look at my answer options. And at this point in the game, we've gone through a lot of test taking strategies. So I'm going to read the answer options and see if you can identify any other strategies that could be in play. Administering pain medication every 2 hours. Is there something in there that you don't like? Hopefully there's a yes, I don't like something in there. Hopefully it's this. What if I'm not in pain? I don't need to give pain meds if I'm not in pain, right? So because that word every is in there, I'm not even going to consider it. It's gone. What about infusing IV fluids rapidly over the first 6 hours after surgery? There's a word in there that I don't really like. It's kind of harsh sounding. Rapidly. Do it rapidly. I mean, if my client is coding, I'm doing things rapidly, but infusing IV fluids, first of all, are we talking about bladder and IV fluids? IV fluids go into my vascular system. Bladder spasms is a totally different body system. So does that make sense related to my question? Infusing IV fluids rapidly? No. But we'll keep that in the back of our mind because maybe you haven't learned it yet. But I just am very cautious on this one because of that word there. What about maintaining the bladder irrigation flow to prevent blood clot formation in the bladder? Could that help prevent bladder spasms? Maybe yes, maybe no. Right? What about clamping the catheter every hour? Oh, it says the word every. Because as that word every, I'm just going to get rid of it. You shouldn't be doing that. But even if you didn't know you shouldn't be doing that, you're going to get rid of it because this is every, and we get rid of things that are absolute words unless they're a big safety issue. So I probably don't like this second one because of that absolute word in there. And I may or may not know that the third thing is a true statement. Like I may or may not know that. However, let's pretend I'm just going to pick one. Go back to your question. Look at your question and say, are there any words or phrases in my question that are in one of the ones that I like, and go with that if that's the case. So we have bladder, bladder, irrigation, irrigation, prevent, prevent, bladder, bladder. There's a lot of repeating words in that one. This one here, nothing. The only thing is the concept of after surgery, and we're after surgery. So see how that can give you some clarity. So I'm going to go with this one here because there's way more repeating words in it. So hopefully that helped. This is one of my favorite things to talk about. And it incorporates a lot of what we've already learned today in this presentation. So therapeutic communication is just paramount. I know we talked about that early on in the presentation, but this is a type of therapeutic communication where somebody's asking you something or they're concerned about something. So there's a really good way to approach these questions. Let's read it. The nurse is teaching the client how to care for her ileostomy. The client asks the nurse how long she can wear the pouch before changing it, and the nurse responds, okay, hang tight. What is this question asking? What's the core of the question? How do I respond to someone who asks me this question? How long can I wear the pouch before I change it? So that's my core of my question. How long can I wear an ileostomy pouch before I change it? So now we have to look at those answer options and see which one best works. And if there's any other strategies that you can pull in from what we've talked about, do it. All right, so let's look at the first one. The pouch is changed only when it leaks. I kind of gave it away to you because I accentuated the word. Only when it leaks. What do we do with absolute words? Do we keep them or get rid of them? We get rid of them. What about you can wear the pouch for about 4 to 7 days? Does that help answer how long I can wear it possibly? Yeah, I would say, for sure, right? So that's a possibility. What about you should change the pouch every evening before bedtime? It's talking about how, like when to change it. However, we'll look at that word there. Bye-bye. And this last one, it depends on your activity level and your diet. So if you've learned about this content, you're going to be like, yes, the second and the fourth one are definitely the ones to think about. And you're going to be like, yep, okay, I like both. Now what? So now what? What do we do when we have the I don't know what to do thing going on in our brain? We go back to the question and we look at the question. What is this question asking? What did we say? How long can I wear the pouch before I change it? That's how we have to respond to that question. So is there an answer option here that best responds to that question? I bet you're saying they both kind of do, right? But let me just preface everything here by saying you're going to have to talk to people in real life. You're going to have to listen to them and decipher what the issues are and what they're concerned about, and then you're going to have to appropriately respond. So you are going to get these types of questions on your boards and in your class because we need to make sure that you can go out there and listen and talk to people appropriately. With that being said, this question the client asks, see that work up to that? It could say the client's concerned about. The mother of a toddler brings a child in because they are concerned about, the family member of the client just walked in and wants to know, like whatever that lead up is, whatever is immediately after that, I want you to hone in on that because that is going to be the core of what you must respond to. You must respond directly to client concerns or questions. And directly responding in this scenario is, I must tell this person how long they can wear it. And if that's the case, if I must be very literal about answering this question, the answer option is number 2 that I should be going with because that gives you a time frame, right? 4 to 7 days is a how long, right? The fourth one doesn't give you a how long. It says it depends. Let's say that you're like, yeah, Mel, but the fourth one is correct as well. That does matter. It impacts it. So you're going to be in your testing, you're going to be like, eeny, meeny, miny, mo. Don't do that. Don't do that, remember? I want you to do this when you're stuck. It's something that I like to do, especially with therapeutic communication questions. If this person was like, hey, Mel, I have this new ileostomy. How long should I wear it before I change it? If there was only one thing I could ever say to that person, I would say, at least every 4 to 7 days, make sure you change that pouch. So I know on day 4, 5, 6, or 7, if that was the only thing I was ever going to be able to say to that person, they would change it on 4, 5, 6, or 7 those days. But if they ask me, hey, Mel, I have this new ileostomy, how long should I wear it before I change it? And I say, it really does depend on your diet and your activity. And they're like, oh, okay, so when do I change it? And they're like, well, it depends on your diet and your activity. And so now they're getting mad at you because they're not getting their question answered. I asked, how long do I wear this before I change it? Well, it depends on your diet and your activity. Doesn't that make you very upset that that person is not answering? So you can go through it that way and say, if there's one thing that is the best response, what's going to be it? But if you were still talking to yourself saying, you know what, but still, I like this one too because it's correct, and that does happen during a test. Even though things are pointing to the second answer option, you're still going to be like, yeah, but it does depend. If you know the content anyway. When in doubt, if you cannot decide, what are you supposed to do? You're supposed to use the repeating word, repeating phrases thing. So I already got rid of the first and the third answer option. So with these two here, I can wear the pouch. I can wear the pouch for how long? This long. It's literally taking the exact question and flip-flopping it around and rephrasing it into a new answer. Versus this one has nothing. No repeating words, no repeating concepts. This is screaming the correct answer. Screaming it. for 3 different reasons that we've talked about. So really pay attention to what the person is definitely concerned about or having questions about, and then specifically answer that. You did it. You made it to the end. Like, I know that was long. It's a lot of really good information, and I have my little quirky ways of talking about things. But just know that you can create your own process. You don't have to use mine. Mine is the read, recognize, wrap. It has been so beneficial to me and to the students who come through my office. If you feel like in the very beginning of the presentation you were having trouble with rephrasing the question in your own words, I hope you did pause and just go practice that. If you did not, hopefully watching me do it throughout this presentation helped a little bit more. But if you still feel like, okay, I'm reading these questions and I still sometimes feel like I just don't know how to rephrase it in my own words, go practice. Go practice. Students who get a hold of me after they take NCLEX, when they are contacting me, I always ask them, what do you feel like really helped you pass the NCLEX? Most of the time, if they've come to me and we've worked together, they say, once I figured out how to actually read the questions properly and put it in my own words, and I knew that the question was asking X, Y, or Z, being really specific, then it seemed to fall into place. So make sure that you're practicing that and that you feel better just being able to have that skill set. Your content knowledge, hands down, is always going to be your most important strategy. Nursing process, keep that in the back of your mind. ABCs, safety, urgency vowels, AEICU. Those are all things that you can take for testing and for nursing practice. The things that we just talked about though, that opposites, the same, the repeating words, those are your trick strategies that you should not be using very often. They should be used very sparingly because they can lead you in the wrong directions, right? But they will be very helpful if you are just going to guess because you have absolutely no idea. And remember, from the very beginning of the presentation, I said, do not just go immediately and try to use these strategies in a test because it can be a source of stress for you if you've not practiced. So get your hands on practice questions, think about the things that we've talked about here, and best of luck to you in your testing. Best of luck to you in your future nursing career. Bye. Thanks again for hanging in there. If you found this to be helpful, I have other videos that you can take a look at. If there's things that you're struggling with specifically related to nursing content or testing, feel free to reach out and I'll try to get back to you.